Medical Assistant Exam Mock Exam. Question 1. For a patient encounter in a busy front office, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The side of the middle or ring finger pad. Option B. The tip of the index finger. Option C. The little finger near the bone. Option D. The center of the thumb pad. The correct answer is option A. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. Question 2. Given the workflow in an infection control audit, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Low temperature. Option B. Rapid breathing. Option C. Slow pulse. Option D. Painful urination. The correct answer is option B. Rapid breathing. Tachy means fast, and near relates to breathing. Low temperature is hypothermia. Slow pulse is bradycardia. Painful urination is dysuria. Question 3. After reviewing the situation in a clinical skills review, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Above normal. Option B. Against. Option C. Before. Option D. Below normal or deficient. The correct answer is option D. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Above normal is indicated by hyper. Against is indicated by anti. Before is indicated by pre. Question 4. After reviewing the situation in an urgent care office, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Follow state law and office policy for consent requirements. Option B. Refuse all care without considering exceptions. Option C. Assume all minors can consent to every service. Option D. Ask another patient in the waiting room to consent. The correct answer is option A. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 5. To protect safety in a treatment room, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Prior authorization. Option B. Matrix blocking. Option C. Wave scheduling. Option D. Stream scheduling. The correct answer is option C. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Stream scheduling assigns patients specific individual appointment times. Question 6. Before the visit continues in a pediatric clinic, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. 4. Option B. PA. Option C. IM. Option D. Subcut. The correct answer is option B. PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 7. A medical assistant is working in a medication administration visit when the medical assistant takes a phone message for the provider. Which information is most important to include? Option A. Caller identity, contact information, reason for call, and urgency. Option B. Only the caller's first name. Option C. A promise that medication will be prescribed. Option D. The assistant's guess about the diagnosis. The correct answer is option A. Caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. A first name alone may not identify the patient or issue. Medication decisions belong to the provider. Diagnosis should not be guessed in a phone message. Question 8. Following office protocol in a busy front office, the term gastroenterology appears in a referral. Which specialty is involved? Option A. Urinary bladder only. Option B, nervous system. Option C, digestive system. Option D, endocrine glands. The correct answer is option C, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Neurology focuses on the nervous system. Endocrinology focuses on hormone-producing glands. Question 9. Following office protocol in a patient intake station, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, disable audit trails to speed workflow. Option B, keep the screen facing the waiting room. Option C, lock the workstation before stepping away. Option D, share passwords with trusted co-workers. The correct answer is option C, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Audit trails support security monitoring and should not be disabled by staff. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Question 10. As part of exam preparation in a quality control review, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, refuse because records belong only to the provider. Option B, give the record to anyone who asks. Option C, delete sensitive information before the request is reviewed. Option D, follow the office release of information process. The correct answer is option D, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Altering the record is inappropriate and may violate legal requirements. Question 11. A medical assistant is working in a treatment room when a reagent bottle is past its expiration date. Which action is appropriate? Option A, change the expiration date on the label. Option B, use it only for abnormal patients. Option C, mix it with a new reagent to strengthen it. Option D, do not use it for patient testing. The correct answer is option D, do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Mixing reagents without approval can invalidate testing. Question 12. When a patient encounter unfolds in a women's health clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, ureter. Option B, alveolus. Option C, platelet. Option D, axon. The correct answer is option D, axon. An axon carries nerve impulses away from the neuron cell body. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. Question 13. Following office protocol in a phlebotomy station, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, schedule the patient for next month. Option B, tell the patient to send an email later. Option C, give a diagnosis over the phone. Option D, follow emergency triage protocol immediately. The correct answer is option D, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Routine scheduling can delay care for potentially serious symptoms. Potential emergencies require immediate action. Medical assistants should not diagnose the cause of symptoms. Question 14. For a patient encounter in an urgent care office, an intradermal test is being prepared. Which description matches the route? Option A, injection just under the epidermis to form a small wheal. Option B, medication placed into the ear canal. Option C, injection into deep muscle tissue. Option D, medication swallowed by mouth. The correct answer is option A, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Ear canal administration is otic. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Question 15. At the start of care in a specialty referral visit, a mask becomes wet during patient care. Which action is appropriate? Option A, share it with a coworker. Option B, keep wearing it for the rest of the week. Option C, dry it on the clean supply shelf. Option D, replace the mask according to infection control practice. The correct answer is option D, replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Question 16. For a patient encounter in a community health clinic, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, sit at eye level and allow silence when appropriate. Option B, keep checking messages during the conversation. Option C, stand over the patient with crossed arms. Option D, laugh to lighten the mood immediately. The correct answer is option A, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Humor can be inappropriate when a patient is distressed. Question 17. During an outpatient laboratory, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, blood culture bottle. Option B, light blue tube. Option C, lavender tube. Option D, gray tube. The correct answer is option D, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Lavender EDTA is used mainly for hematology testing. Question 18. As part of exam preparation in a certification exam scenario, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, quality control testing. Option B, appropriate marketing. Option C, breach of confidentiality. Option D, routine scheduling. The correct answer is option C, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Scheduling does not involve posting private health information publicly. Question 19. When a patient encounter unfolds in a specialty referral visit, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, double booking. Option B, wave scheduling. Option C, clustering. Option D, open hours. The correct answer is option A, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Question 20. A medical assistant is working in a community health clinic when a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record the measurements using the unit required by the office protocol. Option B, round weight to the nearest 10 pounds. Option C, record height only because weight changes often. Option D, use the parent's estimate if the scale is nearby. The correct answer is option A, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Question 21. Before the visit continues in a primary care office, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 5 milliliters. Option B, 10 milliliters. Option C, 1 milliliter. Option D, 0.5 milliliter. The correct answer is option D, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. Question 22. After reviewing the situation in a clinical skills review, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, RICE. Option B, HIPAA. Option C, PERLA. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. HIPAA governs health information privacy and security. PERLA describes pupil assessment. Question 23. While working in an urgent care office, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, move the patient to a chair before assessing. Option B, finish documenting the previous visit. Option C, activate emergency response and assess breathing according to training. Option D, offer water by mouth immediately. The correct answer is option C, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Giving oral fluids to an unresponsive patient risks aspiration. Question 24. After reviewing the situation in a same-day appointment, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, lavender tube. Option B, light blue tube. Option C, green tube. Option D, gray tube. The correct answer is option C, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Gray tubes are often used for glucose-related testing depending on protocol. Question 25. During a procedure setup, a claim requires the code that explains why a service was performed. Which code set is used? Option A, NDC only. Option B, CPT. Option C, place of service only. Option D, ICD-10-CM. The correct answer is option D, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. Question 26. When a patient encounter unfolds in a same-day appointment, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A, allow the alcohol to dry completely. Option B, draw blood while alcohol is still wet. Option C, blow on the site to speed drying. Option D, touch the vein again with an ungloved finger. The correct answer is option A, allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Question 27. The care team in a telephone triage workflow asks for guidance because a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right color of vial and right storage shelf. Option B, right diagnosis only. Option C, right patient, right medication, right dose, right route, right time, and right documentation. Option D, right insurance, right copay, right appointment, and right room. The correct answer is option C, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Question 28. After reviewing the situation in a family practice clinic, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 1 mm per millivolt. Option B, 100 mm per millivolt. Option C, 10 mm per millivolt. Option D, 25 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. Question 29. While working in an internal medicine office, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, atrial repolarization only as the visible main event. Option B, ventricular filling with blood only. Option C, ventricular depolarization. Option D, a lung gas exchange. The correct answer is option C, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Atrial repolarization is usually hidden within the QRS complex. Mechanical filling is not the primary electrical event represented by QRS. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 30. In a phlebotomy station, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask the patient to state 2 identifiers and compare them with the order. Option B. Ask a family member to confirm the name only. Option C. Use the room number because it is faster. Option D. Label the tube after returning to the lab. The correct answer is option A. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. Question 31. The care team in a treatment room asks for guidance because the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, autoclave tape. Option B, tourniquet. Option C, Snellen chart. Option D, hemostat. The correct answer is option C, Snellen chart. A Snellen chart is used to screen distance visual acuity. Autoclave tape indicates exposure to sterilization conditions. A tourniquet helps locate veins for blood collection. A hemostat clamps tissue or small objects during procedures. Question 32. A medical assistant is working in a women's health clinic when an electronic record uses an audit trail. What is its purpose? Option A, track who accessed or changed information. Option B, measure blood pressure. Option C, sterilize instruments automatically. Option D, approve insurance claims instantly. The correct answer is option A, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 33. While working in a medication administration visit, a used needle must be discarded after an injection. Which practice is safest? Option A, place the needle in regular trash. Option B, recap the needle with both hands. Option C, carry the needle to the front desk for disposal. Option D, activate the safety device and place the needle in a sharps container. The correct answer is option D, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Question 34. To protect safety in a phlebotomy station, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, record readings with date, time, and relevant notes as directed. Option B, write only the highest number ever measured. Option C, use another person's readings if the cuff is shared. Option D, skip technique instructions because home cuffs are automatic. The correct answer is option A, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Selective recording can mislead clinical decisions. Readings must belong to the patient. Proper positioning and technique still matter with automatic cuffs. Question 35. As part of exam preparation in a clinical skills review, A patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, Advance Directive. Option B, Explanation of Benefits. Option C, Sterilization Log. Option D, Progress Note. The correct answer is option B, Explanation of Benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. Question 36. While working in a clinical skills review, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, referral. Option B, copayment. Option C, coinsurance. Option D, a remittance address. The correct answer is option C, coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. Question 37. When a patient encounter unfolds in a patient intake station, a voicemail must be left for a patient according to office policy. Which message is safest? Option A, demand payment details with full medical history. Option B, leave another patient's results for comparison. Option C, describe the diagnosis in detail on the message. Option D, leave limited information and a callback number. The correct answer is option D, leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Question 38. The care team in a patient intake station asks for guidance because a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, use a qualified medical interpreter. Option B, ask a young child to interpret. Option C, skip the explanation if the patient nods. Option D, speak louder and slower in English only. The correct answer is option A, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Question 39. For a patient encounter in a procedure setup, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, ophthalmoscope. Option B, reflex hammer. Option C, centrifuge. Option D, otoscope. The correct answer is option A, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. Question 40. During a quality control review, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, demographics, contact information, insurance information, and reason for visit. Option B, only the patient's favorite pharmacy color. Option C, another patient's insurance card. Option D, the assistant's diagnosis before the visit. The correct answer is option A, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. That information does not complete registration. Insurance information must belong to the patient being registered. The assistant should not diagnose during scheduling. Question 41. Following office protocol in an exam room, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, shout from another room. Option B, assume the patient cannot participate. Option C, face the patient and speak clearly at a moderate pace. Option D, cover the mouth while speaking. The correct answer is option C, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Shouting from a distance reduces clarity and privacy. Hearing difficulty does not mean the patient cannot understand or decide. Covering the mouth removes visual cues. Question 42. While working in a treatment room, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Procedure code and diagnosis or reason for the service. Option C. Only the assistant's initials with no service information. Option D. Only the patient's favorite color. The correct answer is option B. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Question 43. Following office protocol in a patient education session, the assistant is comparing two needle gauges. Which statement is accurate? Option A. Gauge has no relation to needle size. Option B. A larger gauge number always means a longer needle. Option C. All injections use the same gauge. Option D. A smaller gauge number indicates a larger needle diameter. The correct answer is option D. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Question 44. As part of exam preparation in a cardiology practice, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Provide standardized guidance for office tasks. Option B. Replace all state laws. Option C. Guarantee every claim is paid. Option D. Eliminate the need for training. The correct answer is option A. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Question 45. When a patient encounter unfolds in an internal medicine office, a medication is labeled for otic use. Where should it be administered? Option A. Ear. Option B. Mouth. Option C. Nose. Option D. Eye. The correct answer is option A. Ear. Otic medications are intended for the ear. Oral medications are taken by mouth. Nasal medications are administered through the nose. Eye medications are ophthalmic, not otic. Question 46. As part of exam preparation in a walk-in clinic, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Ignore it because it is not in an exam room. Option B. Wait until a patient reports slipping. Option C. Cover it with loose papers. Option D. Place a warning sign and arrange cleanup immediately. The correct answer is option D. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Question 47. Before the visit continues in a phlebotomy station, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Tuning fork only. Option B. Suture removal scissors or sterile scissors according to policy. Option C. Ophthalmoscope only. Option D. Peak flow meter only. The correct answer is option B. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. An ophthalmoscope is used to examine the eye, not remove sutures. A peak flow meter measures expiratory airflow and does not remove sutures. Question 48. At the start of care in a women's health clinic, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Ignore all reminder preferences. Option B. Follow office policy and patient communication preferences. Option C. Text any diagnosis to any phone number in the chart. Option D. Post the reminder on social media. The correct answer is option B. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 49. In a cardiology practice, a prothrombin time test is ordered. Which tube should be selected? Option A, light blue tube. Option B, lavender tube. Option C, blood culture bottle only. Option D, gray tube. The correct answer is option A, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluorite oxalate is not the standard additive for coagulation studies. Question 50. After reviewing the situation in an administrative check-in area, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, opening the wrapper away from the body first. Option B, reaching across the sterile field with an unsterile sleeve. Option C, keeping sterile items above waist level. Option D, using sterile forceps for sterile supplies. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Question 51. To protect safety in an administrative check-in area, a patient becomes angry about a long wait time. Which response is most appropriate? Option A, acknowledge the frustration and provide a realistic update. Option B, ignore the patient until the appointment starts. Option C, blame the provider in front of the patient. Option D, tell the patient to calm down or leave. The correct answer is option A, acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Commands can escalate conflict and harm patient rapport. Question 52. During a medication administration visit, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, take the temperature immediately because oral readings are unaffected. Option B, wait according to office protocol before measuring the oral temperature. Option C, switch to a rectal temperature without asking. Option D, record the temperature as normal without measuring it. The correct answer is option B, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Recent liquids can affect oral temperature results. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Question 53. The care team in a walk-in clinic asks for guidance because a student asks which blood component helps with clotting. Which answer is correct? Option A, platelets. Option B, alveoli. Option C, plasma glucose. Option D, neurons. The correct answer is option A, platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Glucose is a blood sugar and does not form clots. Neurons transmit nerve signals and are not blood clotting cells. Question 54. A medical assistant is working in a patient education session when a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, wipe the surface dry immediately. Option C, use the disinfectant only on clean hands. Option D, dilute the solution more to reduce odor. The correct answer is option A, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 55. For a patient encounter in an electronic health record review, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, tell the patient the reading is probably wrong. Option B, promise that the provider will not be concerned. Option C, ignore the anxiety to avoid making it worse. Option D, acknowledge the concern and explain the procedure in simple terms. The correct answer is option D, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Dismissing the result can reduce confidence and may be clinically misleading. Promising an outcome goes beyond the assistant role and may be inaccurate. Ignoring patient concerns can increase anxiety and weaken communication. Question 56. At the start of care in a community health clinic, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, discard the result because it is abnormal. Option B, notify the provider or designated clinical staff promptly. Option C, file the result for review at the end of the month. Option D, tell the patient the exact diagnosis without provider review. The correct answer is option B, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Question 57. To protect safety in a preventive care visit, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, clean and dry the skin before applying electrodes. Option B, move all chest leads to the abdomen. Option C, apply electrodes directly over lotion. Option D, use tape only and skip electrodes. The correct answer is option A, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Question 58. In a diagnostic testing area, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, give the patient food to push it down. Option B, encourage coughing and monitor closely. Option C, perform blind finger sweeps immediately. Option D, leave the patient alone until they stop coughing. The correct answer is option B, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Question 59. An office review in a preventive care visit shows that a patient asks for printed medication instructions. Which practice improves health literacy? Option A, use only complex medical terminology. Option B, tell the patient to search online without guidance. Option C, use clear language and review the key points with the patient. Option D, provide instructions in the wrong language. The correct answer is option C, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Language mismatch can prevent safe understanding. Question 60. A medical assistant is working in an administrative check-in area when a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, prone. Option C, Sims. Option D, Fowler. The correct answer is option A, supine. Supine means lying on the back facing upward. Prone means lying face down. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Question 61. An office review in an outpatient laboratory shows that the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A, ask the patient to explain the instructions back in their own words. Option B, give instructions as quickly as possible. Option C, ask only whether the patient has any questions. Option D, use medical jargon to sound professional. The correct answer is option A, ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Patients may say no even when they misunderstand instructions. Jargon can confuse patients and reduce understanding. Question 62. When a patient encounter unfolds in a specialty referral visit, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Reprocess the instruments before use. Option B. Use the instruments if the package is dry. Option C. Write a new date on the package. Option D. Open the package and rinse the instruments. The correct answer is option A. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. Question 63. Given the workflow in a clinical skills review, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Pack the nose with contaminated gauze. Option B. Tilt the head far backward. Option C. Lie flat immediately without assessment. Option D. Sit upright and lean slightly forward. The correct answer is option D. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 64. The care team in an internal medicine office asks for guidance because the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Slow heart rate. Option B. Inflammation of the liver. Option C. High blood sugar. Option D. Fast breathing. The correct answer is option A. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 65. When a patient encounter unfolds in an internal medicine office, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Ask the patient to remember only prescription allergies. Option B. Verify the allergy information and enter it clearly in the medical record. Option C. Remove allergies that the patient says happened many years ago. Option D. Place the form in the chart without reviewing it. The correct answer is option B. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Important safety information can be missed if the history is not reviewed. Question 66. A medical assistant is working in an infection control audit when the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Give the tracing to the provider promptly according to protocol. Option B. Change the tracing to make it look normal. Option C. Discard the tracing to avoid alarming the patient. Option D. Diagnose the rhythm for the patient. The correct answer is option A. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Altering medical records is unethical and unsafe. Abnormal results must not be hidden or discarded. Medical assistants should not provide a cardiac diagnosis. Question 67. As part of exam preparation in a cardiology practice, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Leave the patient uncovered until the provider arrives. Option B. Discuss the patient's body in the hallway. Option C. Provide appropriate draping and expose only the area being examined. Option D. Skip explanations because the patient signed in. The correct answer is option C. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Question 68. Following office protocol in a primary care office, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Reach across the field with unsterile clothing. Option B. Open sterile supplies without touching the inner sterile surface. Option C. Reuse sterile gloves from a previous patient. Option D. Place sterile gauze on an unclean counter. The correct answer is option B. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Question 69. In a patient education session, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Follow facility policy and do not use it if safety cannot be verified. Option B. Guess the opening date from memory. Option C. Mix it with another vial to avoid waste. Option D. Use it because the cap is still attached. The correct answer is option A. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. The cap does not prove when the vial was opened or whether it was stored correctly. Question 70. For a patient encounter in a certification exam scenario, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Lavender EDTA tube. Option B. Light blue sodium citrate tube. Option C. Green heparin tube. Option D. Gray fluoride oxalate tube. The correct answer is option B. Light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Gray tubes are generally collected near the end of the order. Question 71. Before the visit continues in a phlebotomy station, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Spray disinfectant and wipe it off immediately every time. Option B. Clean and disinfect touched surfaces according to office protocol. Option C. Change only the paper on the exam table. Option D. Open the door to air out the room only. The correct answer is option B. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Disinfectants usually require the manufacturer's contact time to work properly. The exam table paper does not address other touched surfaces. Ventilation alone does not remove organisms from contaminated surfaces. Question 72. A medical assistant is working in a specialty referral visit when the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Right ear normal after exam. Option B. Patient reports sharp right ear pain for 2 days. Option C. Patient seems dramatic about ear pain. Option D. Ear infection diagnosed today. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Exam findings belong to the provider and are not the chief complaint. Subjective judgment is unprofessional and not appropriate for the medical record. A diagnosis should not be documented by the assistant unless the provider has made it. Question 73. After reviewing the situation in a preventive care visit, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Wait for the provider before starting any response. Option B. Give oral medication before checking responsiveness. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Question 74. A medical assistant is working in a diagnostic testing area when the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The reading may be inaccurate. Option B. The oral temperature will decrease. Option C. The patient will automatically faint. Option D. The pulse oximeter will stop working. The correct answer is option A. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Cuff placement does not change oral temperature. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Question 75. For a patient encounter in an urgent care office, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, gallbladder. Option B, urinary bladder. Option C, appendix. Option D, thyroid gland. The correct answer is option D, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 76. Given the workflow in a cardiology practice, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, count the pulse for a full 60 seconds. Option B, use the patient's previous pulse from the chart. Option C, skip the pulse and record not available. Option D, count for 10 seconds and multiply by 6. The correct answer is option A, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Old values do not represent the current clinical status. The findings should be measured and reported rather than skipped. Short counts are less reliable when the rhythm is irregular. Question 77. A medical assistant is working in a telephone triage workflow when a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, gray fluoride tube for all serum tests. Option B, a red or gold serum tube. Option C, lavender EDTA tube for serum. Option D, light blue citrate tube for serum. The correct answer is option B, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Question 78. In a diagnostic testing area, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, shake the specimen vigorously for 1 minute. Option B, place the tube in direct sunlight to warm it. Option C, wrap the specimen in foil or use an amber container as directed. Option D, leave the specimen uncovered at the front desk. The correct answer is option C, wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Vigorous shaking can hemolyze blood specimens. Sunlight can degrade light-sensitive specimens. Delayed or improper handling can compromise results. Question 79. After reviewing the situation in a telephone triage workflow, the provider discusses the function of white blood cells. Which role is most accurate? Option A, produce insulin in the pancreas. Option B, help defend against infection. Option C, carry oxygen as their primary job. Option D, store bile for digestion. The correct answer is option B, help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Bile storage is a gallbladder function. Question 80. Before the visit continues in a community health clinic, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, prior authorization or referral process. Option B, venipuncture. Option C, autoclaving. Option D, auscultation. The correct answer is option A, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Question 81. When a patient encounter unfolds in an outpatient laboratory, A patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test shocks every patient to start the heart. Option B. The test records electrical activity and does not deliver a shock. Option C. The electrodes inject medication. Option D. The machine draws blood through the wires. The correct answer is option B. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. A standard electrocardiogram does not deliver electrical therapy. Electrodes record signals and do not inject medication. Electrocardiogram leads do not collect blood. Question 82. At the start of care in a treatment room, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A. Battery. Option B. Implied consent. Option C. Informed consent. Option D. Abandonment. The correct answer is option C. Informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Battery involves unauthorized touching or treatment. Implied consent is inferred from actions such as extending an arm for a blood draw. Abandonment involves ending care without appropriate notice. Question 83. A medical assistant is working in an exam room when a claim requires the code for an office visit procedure or service. Which code set is used? Option A. CPT. Option B. Zip code. Option C. Policy number. Option D. ICD-10-CM. The correct answer is option A. CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. ICD-10-CM codes describe diagnoses and reasons for services. Question 84. At the start of care in a quality control review, a rapid strep test requires a throat swab. Which technique is best? Option A. Collect sputum from a deep cough. Option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option C. Swab the outside of the lips. Option D. Touch the tongue repeatedly to collect saliva. The correct answer is option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Saliva and tongue contact can dilute or contaminate the specimen. Question 85. Before the visit continues in a walk-in clinic, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Clarify the order before proceeding. Option B. Interpret the abbreviation however it seems most likely. Option C. Ask another patient what the abbreviation means. Option D. Ignore the medication order completely without communication. The correct answer is option A. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. The order should be clarified rather than silently ignored. Question 86. After reviewing the situation in a quality control review, a patient falls in the exam room. Which action is best? Option A. Hide the incident if no one saw it. Option B. Tell the patient to drive home without evaluation. Option C. Call for help and assess for injury before moving the patient. Option D. Pull the patient up immediately. The correct answer is option C. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Falls must be reported and documented according to policy. The patient should be assessed before leaving. Moving the patient before assessment can worsen an injury. Question 87. As part of exam preparation in a pediatric clinic, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Use only sterile gloves without a mask. Option B. Place the patient beside an immunocompromised patient. Option C. Skip precautions if the patient is already taking medication. Option D. Apply droplet precautions and offer a mask according to protocol. The correct answer is option D. apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Treatment does not remove the need for appropriate precautions. Question 88. When a patient encounter unfolds in a quality control review, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, emancipation. Option B, coordination of benefits. Option C, battery. Option D, defamation. The correct answer is option C, battery. Battery can involve intentional touching or treatment without consent. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Question 89. An office review in a quality control review shows that a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, deep into the deltoid muscle only. Option B, into an area that is bruised and inflamed. Option C, directly into a vein. Option D, abdomen with adequate subcutaneous tissue. The correct answer is option D, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Intravenous administration is a different route and is outside a subcutaneous injection. Question 90. While working in a busy front office, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, height and weight. Option B, blood pressure and temperature. Option C, pulse and respirations. Option D, oxygen saturation and pain score. The correct answer is option A, height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Question 91. Before the visit continues in an internal medicine office, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, share the chart because staff work in the same clinic. Option B, deny the request because there is no job-related need to know. Option C, open the chart if the coworker promises not to tell anyone. Option D, print the chart and remove the patient's name only. The correct answer is option B, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. Employment at the same clinic does not automatically authorize chart access. A promise does not create a permitted reason for access. De-identified information must meet specific standards and curiosity is not permitted access. Question 92. While working in a patient education session, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, specimen collected from the toilet bowl. Option B, clean catch midstream specimen. Option C, first drops of urine into an unclean container. Option D, a random sample from an old urinal. The correct answer is option B, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Toilet water contaminates the specimen. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Question 93. Before the visit continues in a diagnostic testing area, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, leave the patient standing while searching for forms. Option B, ask the patient to walk faster. Option C, assist the patient to sit or lie down safely. Option D, tell the patient dizziness is impossible. The correct answer is option C, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. Question 94. As part of exam preparation in a patient intake station, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, by mouth. Option B, as needed. Option C, every morning. Option D, immediately. The correct answer is option B, as needed. PRN means the medication is taken as needed according to the order. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. Question 95. To protect safety in a clinical skills review, a patient feels faint during a blood draw. Which response should occur first? Option A, finish filling the tube before responding. Option B, stop the procedure and protect the patient from injury. Option C, leave the patient alone to find paperwork. Option D, tell the patient to stand up quickly. The correct answer is option B, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Continuing the draw can worsen the situation and increase injury risk. A faint patient should not be left unattended. Standing can worsen faintness and lead to a fall. Question 96. A medical assistant is working in a pediatric clinic when the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, disinfection always destroys every spore. Option B, organic material can interfere with sterilization. Option C, packaging instruments makes cleaning unnecessary. Option D, sterilization is the same as hand washing. The correct answer is option B. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Question 97. As part of exam preparation in a pediatric clinic, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, handle the dressing with bare hands. Option C, use gloves and dispose of the dressing according to biohazard policy. Option D, save the dressing in the patient's purse. The correct answer is option C, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 98. In an internal medicine office, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, have the patient walk quickly before the measurement. Option B, measure blood pressure and pulse in different positions according to protocol. Option C, record the first seated blood pressure as orthostatic. Option D, measure only oxygen saturation while the patient is seated. The correct answer is option B, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Exertion can distort the readings and increase fall risk. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Question 99. While working in a women's health clinic, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, place all charts open on the counter. Option B, speak quietly and avoid announcing sensitive details. Option C, state the full diagnosis loudly to confirm the visit. Option D, ask other patients to help verify the record. The correct answer is option B, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Question 100. After reviewing the situation in a procedure setup, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, choose the pharmacy closest to the clinic. Option B, update the preferred pharmacy after verifying the new information. Option C, leave the old pharmacy because it is already in the chart. Option D, delete all pharmacy information from the record. The correct answer is option B, Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows.